You're watching KCAL 9 News at 2.
Well, doctors know that your hormones really can control almost every aspect of your life, from your emotions to your energy level.
So when you don't feel well, your hormones could actually be out of balance. The problem is that a lot of doctors only treat the symptoms and not the problem. Joining us today is Dr. Rashel Tahzib. He's an expert in hormone replacement. Doctor, thanks for being with us.
Thank you for having me.
It's something I guess a lot of women deal with, and men too, but don't always know what's going on, huh?
Absolutely. You know, I think one of the common problems is that hormone imbalance is underdiagnosed and undertreated. Hormones affect virtually every aspect of our health and well-being, and many times routine blood tests don't check for hormone imbalance. And when they do, for example with the thyroid, standardized routine blood tests don't adequately reflect hormone deficiencies. And so you have many patients who are suffering from the symptoms but aren't really being adequately diagnosed and treated.
And I think some of the symptoms are very similar symptoms of other things that are going wrong. So
Absolutely
as you said,
right.
It's hard to diagnose. What are some of the symptoms? What should men and women be looking for?
That's absolutely right. You know, a lot of times I have patients who've had routine blood tests and they said that, you know, their doctors have said that they've been normal, yet they don't feel well. And some of the symptoms we commonly see in men and women, you know, can be low energy, fatigue, low libido. We see anxiety, depression, insomnia, of course, menopausal symptoms in women. We can also see high cholesterol, diabetes, hypertension, and aging itself. All of these can be side effects of low hormones, and a lot of times they're treated with pharmaceutical medicines for different, you know, for insomnia or anxiety or depression, where part of the main problem is hormone imbalance.
So once it's figured out what we actually are dealing with here, a hormone imbalance, how do you go about treating this?
You know, a good way to safely and appropriately treat hormone imbalance is with natural bioidentical hormones. And bioidentical hormones have exactly the same molecular structure as the hormones in our bodies. These are different than the synthetic hormones that are used and have a lot of the side effects. For example, synthetic progestins are different than natural bioidentical progesterone. And the root is also important. Estrogens have been used orally synthetically and have been shown to have many side effects, whereas transdermally estrogen is beneficial and can be beneficial. So we use bioidentical hormones. Patients feel better and we really don't see the side effects.
So when you talk about the synthetic ones, you're talking about the patches that are out there, the pills, things like that. How are these administered, the natural ones?
The natural hormones are, again, administered mostly transdermally.
So that would be on the skin?
Again,
a patch, or?
It can be a patch, but it could be a cream. They can be, you know, sublingual. We don't ever give estrogen orally. You know, certain progesterone can be given orally or transdermally. In men, we use testosterone, which can be given transdermally or intramuscular. We can also give them subcutaneously.
Years ago, when hormonal treatment were just starting, we heard about all these studies of cancer risks and so forth. What's the result of all that? Has all that been kind of studied enough to where we now have a good feel of what's going on?
You know,
there?
I mean, when have we really studied anything enough? But, you know, a recent study, actually, a peer-reviewed journal, took a look at all the studies done out there on bioidentical hormones. And actually, there have been no studies that show that there's any side effects or risks. And actually, it's preventive, and they've been shown to prevent heart disease and breast cancer.
How soon after the treatment begins should men and women expect results?
Very soon. I would say, you know, sometimes even within 1 or 2 days, and definitely within the week. I mean, immediately.
Wow, that is quick.
Yes.
And again, what forms are we talking about? What's the most common form of giving someone hormones?
So, you know, for men, again, we can use transdermally or intramuscularly. And for women, we use, again, transdermal creams. You can use patches, but transdermally, or certain hormones can be used orally or sublingual, but creams.
So I guess the message is, if you're having any of the symptoms, see your doctor.
Absolutely. And you want to make sure you see a doctor who's doing the right tests and looking at, you know, more than the routine tests.
Yeah.
Yeah. Thank you, Dr. Tahzib.
Thank you for having me.
For more information about hormone imbalance, you can go to KCAL9.com. Click on Seen on TV. We have a link there for you.
All right. Dr. Rashel Tahzib, thank you so much.
Thank you very much.